Okay, thank you everybody for joining this call with me today. I'm so excited to be here to talk about my new bill, the Affordable Insulin Now Act. First, I want to say thank you to the American Diabetes Association, Georgia chapter, and Georgians for a Healthy Future for pulling together this important briefing. I also want to thank you all for the fight that you are engaged in every day for Georgians living with diabetes, and for supporting my bill to cap the cost of insulin at $35 per month. As a pastor, I've seen up close how devastating diabetes can be if it goes untreated. Over 1 million Georgians have diabetes, 1 million. And it would be hard to find someone in this state who doesn't know someone with diabetes. That's why passing this legislation will help hundreds of thousands of Georgians and millions more Americans. I've been working to make healthcare more affordable since the day I arrived in the Senate. I've been fighting to strengthen access to free and affordable healthcare and to lower the cost of prescription drugs. So this latest bill is a part of that ongoing work. Nowhere is the need to lower the costs of prescription drugs clearer than in the case of insulin. As I do this work, I think often about my new friend, Evan, an 8-year-old I met not long ago, who has type 1 diabetes. And his family spends $9,500 in out-of-pocket costs a year just to manage his diabetes and to keep him alive. When the struggle to get this done, like so much in Congress, gets tough, I think about Evan, because he's the one who really has it tough. What a brave kid at 8 years old. When I met him, he had a note for me, and he said, "Thank you for fighting for me." And so I'm going to keep this fight up for Evan. Over the last decade, insulin prices on average have doubled, and in some cases tripled for many Georgians, for many Americans. I saw one study that said that people with diabetes spend close to $6,000 on insulin alone. Think about that. The average American, folks with perhaps $400 in a checking account or in a savings account, people struggling to make their everyday lives work, $6,000 alone just for the insulin. And that's why the Affordable Insulin Now Act is so important. It will require insurers to cap their patient out-of-pocket costs to no more than $35 per month for insulin. This will reduce out-of-pocket costs for many insulin products and provide savings to millions of insulin users. I'm working hard right now to get this through committee and to the Senate floor for a vote as soon as possible, hopefully before Easter. I'm hoping that by Easter, there will be a kind of resurrection of hope for people who struggle every day, millions of Americans who have diabetes. And so right now I'm talking to colleagues on both sides of the aisle to see if we can make it bipartisan. I was speaking to a member of the Senate on the other side of the aisle as recently as last night about the urgency of this issue and how hard we must work to get something done. It's clear to me that this is not an ideological issue, it's a practical one. And that's why it has already garnered support in blue and red states on both sides of the aisle here in Washington. There are many states already that have capped the cost of insulin. And that's why I'm so grateful for the folks who are on this call. It's hard to overstate how important your advocacy really is. Know that I'm going to take your powerful stories to my colleagues right here in the Congress with the hope that politics will not get in the way of the people and their needs in a moment like this. So thank you for your hard work and your advocacy for Georgians. I'm truly honored to be your senator and to work for the things that really matter. Keep the faith.
Thank you. I just wanted to flag, so we have 2 questions for you, Senator. The first is going to be from Pat Edwards from MedBank Foundation. So if Pat, you can unmute yourself, that would be great. And I can also try to help.
Thank you so much. Senator, it is really an honor to be on this call with you today. I'm Pat Edwards, and I'm the Executive Director of the MedBank Foundation in Savannah, Georgia. We have been providing free medicine to the uninsured and underinsured since 1992 in 6 coastal Georgia counties. And I'm sure you are probably aware here in Chatham County, 13% of the population is diabetic, but what's so concerning to me is there are pockets of the population, particularly in some low-income minority communities, where it's as high as 24%. So my question to you is, why is this legislation so important to you? I know you mentioned a few things, but I wanted to ask you that directly.
Well, thank you so much for the question, Pat. It really emerges from my experience as a pastor, walking with people through their many challenges, including their health challenges. I have seen up close the devastating impact of this disease, especially when it goes untreated. I've seen the amputations. I've been there with families trying to encourage a loved one as they get the news that they have to go on dialysis. So diabetes is a part of a whole network of potential health issues when it goes untreated. If you need insulin, you really need insulin. It's not a convenience, it's not optional. And this drug has been around for 100 years. So the pharmaceutical companies can't say that they're spending this money on research and development, not where insulin is concerned. They're raising the cost because they can, and we have an opportunity to bring reason, common sense, and a sense of humanity to this. And I'm proud of our ability to do this legislatively. I hope we can get this done sooner than later.
I hope so too, and so do your constituents and the people here in Georgia and all across the rest of the country, but it is very much needed. Thank you.
Thank you.
And then we're going to have Laura Colbert ask the next question. Laura is from Georgians for a Healthy Future and is incredibly helpful on all of the things that you have worked on for healthcare. So.
Thank you. Hi, Senator. Thank you so much for your work on this bill. Obviously, with any healthcare legislation or any legislation at all these days, it's a tough political climate and a tough kind of pathway through to get a bill signed into law. So what are you doing to ensure that, that this bill gets through Congress successfully and can get to the president's desk?
I'm talking to my colleagues on both sides of the aisle. And we really should have a clear path to get this done. There are several states, blue and red, that have done this. Oklahoma has capped the cost of insulin. So has Utah. So has Alabama. So it's clear that this is not an ideological issue, it's a health issue. And what I'm trying to do is to get folks on both sides of the aisle in Washington to do what folks on both sides of the aisle are already doing in many of our states. And so we're going to be working hard, and hopefully we can get this done by Easter, and there can be a resurrection of hope for ordinary folks who struggle with this disease.
I hope so. Thank you.
Thank you.